Hello everyone, my name is Chloe Knox. Today I'm going to be discussing the knee joint. It's going to be at the distal end of the femur and the proximal end of the tibia. It's composed of the patellofemoral joint, the lateral tibiofemoral joint, and the medial tibiofemoral joint. At the very end of the femur there are two condyles, medially and laterally, which form a curved surface for the tibial plateau to attach to, and the patella sits at the patellofemoral groove. These are the four ligaments of the knee. The tibial collateral ligament, the MCL, prevents too much medial movement. The fibular collateral ligament, also known as the LCL, prevents too much lateral movement. The anterior cruciate ligament, the ACL, and the posterior cruciate ligament, the PCL, prevents unwarranted excessive movement in the sagittal plane. So the meniscus are going to be two C-shaped cartilaginous structures that sit on the plateau of the tibia. They spread the upper body weight equally across the tibia so that too much is not in one area. And as you can see, the meniscus sits on top of the tibia plateau. The knee is a hinge joint, so it allows movement only in the sagittal plane. That's going to be flexion and extension. There are slightly small degrees of motion in other planes, but not a sufficient amount for it to be considered any other joint. The knee joint is uniaxial, meaning it's only going to occur again on a single axis. That's going to be the sagittal plane with flexion and extension. This is going to be a diagram of the axis of movement that occurs at the knee. So it's going to occur along the sagittal plane, and flexion happens when the tibia moves posteriorly along the sagittal plane, and the tibia and femur, the angle between decreases. With an extension, the tibia moves anteriorly, and the angle increases between the tibia and the femur.